we have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Dr. Emanuele Capobianco is the head of strategy and impact at the World Health Organization Foundation. He joins me now from Geneva. Good to have you on the show, sir. Okay, so 5 deaths so far as a result of this outbreak and 16,000 thereabouts cases globally. What about this prompted the World Health Organization to issue its strongest call to action?
I think a couple of factors. First, this outbreak has been spreading from Africa, West Africa and Central Africa to many countries. So we have an outbreak that has been moving rapidly. The number of cases have been increasing over the past few weeks and months, and there is a risk that this outbreak may move into the general population. And so the WHO decided to declare this as a public health emergency of international concern, which is the loudest alarm bell that the WHO can ring to activate a global response against a public health threat.
Emanuele, you talked about spreading. You talked about this virus moving into new areas. Enlighten me. I mean, how much do we know about the modes of transmission of monkeypox?
So we are trying still to understand, but it's very clear that the contact with people that have lesions that are monkeypox can spread the infection. Sexual encounters with people that have this infection can spread the infection. We are trying to investigate whether there are other types of transmission. At the moment, the virus is spreading, but this outbreak can be stopped. And that's why this declaration is very important, because we do have a vaccine to block the transmission. It's an effective vaccine. And we do know that the people that are mostly affected at the moment are men having sex with men. And so intervening to support this group and preventing further transmission is absolutely critical. We also know that there are cases in the general population. Yesterday, there were cases among children, 2 cases in children in the US. So we need to be on high alert to intervene as fast as we can.
Emanuele, Dr. Tedros said that this is an outbreak that can be stopped. You just said that as well, but only with the right strategies and within the right groups. Explain that. What does that mean?
So one, it means to move fast. So this has been spreading already for a few weeks. So it's very important now to accelerate the response. Second, we know that this virus is spreading at the moment, particularly among men having sex with men, and particularly among men that have multiple sexual partners. It is very important to detect the cases and to be able to intervene and protect all people that maybe have been around the cases with vaccination. It's very important to ensure that people who have multiple sexual partners, men having sex with men with multiple sexual partners, do protect themselves. And while we do this, we need to fully respect the rights of these communities, avoiding the emergence of stigma and discrimination as we saw in other outbreaks in the past. And as we know, not all countries are welcoming vis-a-vis this population. And so it's very important to be very, very open and understanding that by intervening, supporting, in blocking the transmission, we are really doing a service that helps the entire world, and we can contain this outbreak.
Just want a note to our viewers that we will be continuing to cover the story throughout the evening here on TRT World. But for now, Dr. Emanuele Capobianco, thank you very much for joining us here. Do appreciate the analysis.